Hi y'all. So today I actually have been meaning to do this video for a long time and um, it's been a little bit delayed, but I think this is the best time to actually talk about what to expect when you're messaging either a Naira Counseling and Psychological Services or messaging me or calling. So what usually happens? Let's go through first messaging the Anarian counseling and psychological page. So what's going to usually happen is you're going to leave a message or you're going to probably attempt to book an appointment. So the appointments are very strange because I have set it for an hour and a half gap and that appears, but it seems like persons can customize, which I have to change. So any techie persons out there, if you know what to do, let me know. Um, you can't do anything less than an hour and a half for your first session. And so if you're trying to book an appointment, it'll prompt me, and then I usually have to come and have a conversation, say, well, there's no 30-minute session. In general, there's no psychological services that offer 30-minute sessions, or they shouldn't, because there's not so much, you can't really cover much in 30 minutes. So that's the first thing. Your first session is going to be an hour and a half, and then every session after that is an hour. So then I'll come and have this discussion. We'll see if we can find a date or a time that works best for you. Same thing if you're messaging. I'll usually probably ask, can you briefly tell me what is the issue? Just to make sure that I, A, have the competency, and B, that you're not coming to me for something that I can't particularly resolve, that psychotherapy can't particularly resolve. A lot of times some persons are asking for medication. Like I said in the previous video, psychologists and psychiatrists are not the same, and thus I do not have the capacity of a psychiatrist who can give you medication. So that's usually why I like to get an idea of what it is that is bringing you to therapy. If you're going to call, I get a lot of calls from persons who've been referred by Mercy doctors, and they're told that I'm a doctor. I am not a doctor. I am not Dr. Can. I am just little old Miss Can. And so I cannot give you any kind of medical advice per se. I do have experience with medical stuff related to psychology, but I'm not a psychiatrist. So I can't tell you to up or down a dose. I can't tell you what else to take, nor can I prescribe. So usually persons will call, they'll tell me, who they are, who they got, and who told them to call. They will also tell me, what's happening. And this is when I get to, again, assess whether I can help them or not. What usually is going to happen is I can help you and we look to book a day and time. If I can't help you, I will give you numbers for other psychiatrists that can, or maybe a psychologist that has specialty with drugs and alcohol or child abuse or trauma. Even though I do trauma, I do encourage persons to seek out specialized psychologists who have trauma-informed therapy experience, especially if it's years and years of trauma. And again, depends on the case. I do deal with clients who have trauma, so that's not a problem. Now, usually, a couple of days or a day before, I'll give you the address for the office. We're not working from our offices right now, so this would not be a part of the plan. Usually the next thing is I need an email address. I'm going to send you a Zoom request. So check your emails for that. If you don't have Zoom, Zoom is going to prompt you to download it. The other thing that we're seeing, persons are using Skype and Gmail Hangouts, but I find that the connection is not very good on those sites. And so I've kind of taken over to Zoom because it just seems much more clearer, better connectivity, etc. As you can imagine, when your first session is going to be with a psychologist, you're going to be nervous. That's totally understandable. The last thing I want is to make you more nervous by the internet glitching or saying, can you say that again? Can you say that again? I can't hear you. So I try to make sure that the connection that we're using is one that's going to work. And so the next thing that's going to happen is usually there's discussionable payment. Currently, persons are paying via online banking. Some persons are paying, like my current clients, they're dropping off at the office because they already know where the office is. I really don't want to send a new client to the office and then they put it in the wrong gate, or they put it in the wrong mailbox, or they put it in the wrong doorway. So we don't want to be sending persons who don't know the office to the office. For my current clients, I will be messaging you guys about a slight change in location just for the protection of the payment. And so online banking seems to be the best thing right now. We're having some issues with online banking in the sense of a lot of Guyanese don't have it. And so I may have to eventually buy a P.O. box. And so we're looking to see if Campbellville post office has P.O. boxes. And so you would just go drop it off at the Campbellville post office and put the payment in there. I think that might just be the most central. The other one was Robb Street, closer to Fogarty's, and I just think, and back again, and I think that's just crazy for people who are driving to find a space, and also for me who's going to pick up the payment to find a space to park. So I think Campbellville might be the best option. You guys tell me if you think Campbellville is a more central option, if that works. So just leave a comment below and let me know Campbellville versus Robb Street. Another thing to expect is that once all of that logistical stuff is done, usually what I'll do is send the consent form ahead of time, and you will review it. If you have questions, you let me know first thing in the session, or you can let me know via email, and then you will sign it, even if it's just an initial, and then PDF it and send it back to me, because basically what you're doing is consenting to therapy. You're consenting to understand that there's confidentiality built in, that anything related to whether you're attending therapy, your schedule, when you're coming, or notes or anything of the sort is kept confidential, unless you release that information to me in a formal document, which I also have. And then, of course, the consent form goes on to talk about ethics in the sense of there are going to be exceptions to confidentiality. That is, if you have immediate plans or current plans to harm yourself, harm anyone else, if there's any abuse to anyone under the age of 18, or if I'm court ordered. Luckily, not so luckily, again, we haven't hit a place where persons are court ordering psychologists as yet. So we haven't had to, tell people, hey, I've been court ordered, or anything like that. So not a worry at this point in time. Once you come to therapy, again, this is going to be so different if you're doing in-person therapy versus online. So in-person therapy, we would go through the consent form together. That is one of the bigger things that is different. We go through all the forms together. Whereas when you come to therapy, we will just briefly online, we'll just briefly go through the consent form, and then I will start doing my client intake and client assessment over the internet. So somewhat different. You can't, you could see me, but, I think people just feel much more comfortable looking at their therapist in their face and being like, okay, are you real? Are you the same personality that you are on your videos and that kind of thing? So I do understand that online is going to be different, and I personally prefer in person because I am a very hands-on therapist. So I have worksheets and books and handouts that I like to go through, and so it's very hard right now. I have to be like showing you the piece of paper and then subsequently sending it to you after. And then you can go through it again. But in therapy, I mean, we go through all the worksheets together, we go through all the information together, and that kind of thing. So there is a lot of learning that happens in therapy. Yes, there's times that you're going to be talking and it's going to be very expressive and sharing, and it's going to be difficult, understandably. But to my feelings about therapy is that it's also a learning experience. You're learning skills, you're learning things that you just were not taught about life and emotions and controlling those emotions and dealing with trauma and knowing what's the best way to manage a toxic environment and stuff like that. So these are some of the things that you can expect to experience when you come to therapy. Now, something I really wanted to get across to persons is that therapy is not one session and done. You are not going to unravel years of issues and years of trauma and years of neglect in 1 to 2 to 3 sessions. Most persons come into therapy for 2, 3, 4 months. Some people come for 6 months. Some people come for 8 months. Of course, as you finish up and you're meeting your goals, because at the end of the first session, certain goals need to be established, therapeutic goals. What do you want my help with? Why are you coming to therapy? What do you want support in resolving? And so I always tell clients, think about that before you come to therapy. And then, and of course, some persons know how to put in words, some persons don't. That's why I'm there. I'm there to help you put some of your goals into words and make them measurable and make them tangible. And so, as we go along through this therapy and the weeks and so on, we'll be checking it. Are we meeting our goals? Are we staying on top of it? Do you feel like you're getting better? Do you feel like we're addressing what you actually came to therapy for? Because I'm very clear on that. I don't want people wasting their time, right? And their money. Therapy can be very useful if you are dedicated and motivated. And of course, if you have a good therapist, but it also comes back to you because you're the one who has to do the homework. You're the one who has to do the journaling. You're the one who has to do the practice of confronting your fears. And so sometimes therapy can be scary, and that's okay. What usually happens at the end of the X amount of weeks or whatever sessions is there must be termination. I have had so many persons, like if I've seen 150 Guyanese in the past year and a half, I think only maybe like 50 of them have terminated because I don't know if it's a Guyanese thing. I don't know if it's just a human behavior thing, but persons, when they start feeling better, they stop coming to therapy, which is totally understandable. But they need to also understand that a part of the process of therapy is there should be termination. There should be a session that's dedicated to looking back at what you've accomplished, what were your challenges, what you've learned. And it's a really beautiful way of looking at where you've come from to where you are now. And that usually comes, termination usually comes with both persons, but specifically you saying, you know what, I think we've met the goals. I think we've done the work. And I feel like I can move on from therapy now. And for some people, that's after 9 weeks. For some people, that's after 19 weeks. And so it just really depends. But termination is very important. I really wish more Guyanese would come back for their termination. I have about like 30 files that are not cold cases. Like they're still kind of actively open because I'm still hoping that these clients will come back for their one last session. And it's just right now is not the time to come back for your last session, but I really hope that when we return to normalcy that my clients will all kind of come back because they're still considered continuing sessions, right? Continuing clients. And so those are some of the things that I think what you can expect when you consider going to therapy. I don't expect clients to come every week. I always give clients the option of depending on their finances, their location. Some people are not even from this region. They can only come once a month because it takes them 2 hours to get to a session and 2 hours to go back home, right? So I always tell persons it's up to them. Obviously, in more severe cases, I would say I think you should come every week. But there are persons who only need to come once every 2 weeks, and that works for them financially, time wise, and mentally, because therapy every week can be draining. And I always tell persons like pick a time that's like where you can be kind of calm or not overwhelmed, because when we used to have in person, persons go from going to work from 8 in the morning to 5 in the afternoon and then come in for 5:30 sessions, and you're not getting home till like maybe 7, 8, depends on where you live. And so it can be very draining that you've been actively alive and focused for 12 hours of the day, half of the day, right? So do consider that when you're booking a session. Are you booking a session in a place and time where you can focus and not feel overwhelmed? And the last thing I just want to say, I'm going to ask people if they have any questions, but the last thing I was going to say is I know that one of the challenges with online currently is that you're going to have a difficulty finding a space. And I get that. And I said this in the last session, in the last video, that if it is in a case of suicide or domestic violence and stuff like that, I will try to make the efforts to come out of my house, take all the requirements and protective steps to make sure the place is clean and I'm clean and this, that, and so on. But I know that for the average Guyanese, you have your children home, you have your families home. Those are the people who you might need to talk about. And so it's very difficult. And if that's the case, I would say, is there any other place you can go that can maybe facilitate that discussion? A family member's home that you can just go and lock up in their bedroom or something. Or find a day and time when you are alone. Maybe your spouse or roommate they have to still work. So there is an hour a day where you are alone. Or if you can, your kids can go outside and play for the hour or something like that. Just see, and we'll try and work around it together. I do understand that maybe we may not be able to do a full hour and a half for the first session, but any session at this point in time, I believe, is better than nothing. So I just wanted to give you guys that information because I've been hoarding that information for like a year, and I wanted to do a video specifically for it. So do leave questions in the comments, and do let me know if you have any more tips, even like how to find a space or how to talk to your family about, mommy or daddy, we need to go, I need to talk to this doctor online, kind of thing. So even having that conversation with your children is also important. Okay, so thank you for tuning in. I'm very happy I got to get that information off of my chest. And I hope it's been helpful, and hope in helping you understand like what to expect when at least you contact me. I can't speak for other therapists, but this is my process. Have a good day. Happy Arrival Day to all of the Guyanese. It's a great day. I think it's one of in the favorite memorial kind of days, because it does speak about our history and where we've all come from, even the the negative things that came with that, and dentureship and so on. But it did create really who we are to this day. So peace, love, and I'll talk to you guys soon enough. Have a good day.